Did you know that June is Men's Health Awareness Month? Guys, what are you doing for your health? Because one issue facing many men is not life-threatening, but it is bothersome and can cause complications. And here to tell us more is Dr. Ahmad Azzawe, urologist with Baptist Health System. Thanks for being here.
Thank you for having me.
Okay, for those who may not know, what is this condition?
BPH, or benign prostate hyperplasia, is an enlargement of the prostate. And so it's a condition that affects a lot of men, and as you get older, the more likely you are to have it. About half of men over 50 will develop some symptoms of it, and symptoms typically tend to be urinary symptoms. Men may go to the bathroom a little bit more at night. The stream's a little bit slower, more difficulties emptying the bladder, and over time, this can kind of progress to difficulties making it to the bathroom in time, or even urinary retention requiring a catheter.
That's just some of the ways that it can affect quality of life, right?
Absolutely. If you imagine some guys, trying to get their sleep at night, and you're getting up 4 or 5 times a night, that can disturb your sleep and really affect things. So it's a big factor in quality of life, and day to day you're kind of looking for the next restroom, and it's a challenge for some men, and there's easy solutions and options that we can kind of talk about to take care of that.
All right, let's talk about some of those easy solutions and options. What is the treatment for it?
One option is aquablation. So aquablation is kind of one of these newer therapies that utilizes robotics. It's pretty advanced in regards to kind of what it offers compared to some other options. Of course, speaking with your doctor on options and what's right for you is going to be important, but one of the neat factors of this procedure is durability. It works really well for a lot of men for a longer period of time, less sexual side effects, so some of that factors into a lot of these treatments, and good efficacy, meaning it works really well for a lot of men, has a wide range of prostate sizes, because not every man's the same, and so this helps us individualize each treatment for each man, and with the use of robotics and advanced technology, really helps minimize side effects, and shows us a lot of good consistency in what it does.
Now you mentioned robotics and advanced technology, and that is, it's everywhere now. Tell me about this robot.
So it's essentially robotically guided. So it's all algorithm based, but it's based on kind of the parameters we set. We're monitoring it. We're not just going to leave you up to Wally to kind of take care of your prostate, but overall it helps us with treating the condition. It uses kind of advanced image mapping and things like that isn't available with any other prostate treatment to this time right now. And with that, I think that's kind of a big factor in outcomes, tailoring each individual treatment for each patient.
And so what can folks expect after the treatment?
Well, there's a recovery period of time, and it varies for a lot of men. But overall, the big goal is at the end of the day. A lot of men may take medicines for their prostate and potentially come off of those medicines. So less medicines, less things to take on a daily, improvement in quality of life factors such as urinary symptoms like bathroom trips at night, improved urgency and frequency, and overall better confidence in kind of how your bladder is going to treat you through the day.
Are there any tips to kind of help prevent the condition?
It tends to be genetic. There's other kinds of factors that come into play. Your body, so if you start developing any symptoms, it never hurts to talk to your doctor about them and talk to a urologist about some of the options that are available if your body tells you, hey, my urinary symptoms, my urinary habits are changing.
Dr. Ahmad Azzawe, urologist with Baptist Health System, thank you so much. You can learn more by visiting baptisthealthsystem.com/aquablation. Doctor, thank you again.
Thank you for having me.